All right, we are dispatched to a motor vehicle accident. I have my PPE, not visible. My assistant right here with me, bugging me. And the mechanism of injury was ejection from a car. I am going to immediately request ALS backup, and based on the mechanism injury, I will consider full C-spine precautions. So, my general impression is we have a 25-year-old male, unconscious, lying on the floor. I'm going to check his level of consciousness before I say unconscious. He's not responding, however, he does respond to painful stimulus. I am going to check his airway. His airway is patent. I'm going to listen to his lung sounds. Okay, it looks like we have some decreased breathing on the left side. So I'm going to initiate high flow oxygen via non-rebreather, 15 liters per minute. I'm going to make this a high priority patient, and of course we're going to transport immediately, but while I continue, we've taken care of the breathing. We're going to check the respiratory rate. We're going to get a respiratory rate of about 25. Skin looks pale, cool, and diaphoretic, so I am going to manage shock by keeping the patient's body warm, but so we can continue the observation. I'm not going to do that now. And I'm going to check the pulse. We have a weak radial pulse of 120. All right, and now I'm going to attempt to take a sample history. However, the patient's not reacting to my questions, so we're going to have to continue. I take a set of vitals. The respiratory rate was 25. We take a blood pressure of 90/70, and the pulse is 120, weak radial, as stated. So next, I am going to go from head to toe. We're looking for any deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, or swelling. I'm going to check the no fluid coming from the ears. Now we're going to check the eyes. And the pupils are equal and reactive. All right. Then we're going to go down. I'm going to palpate the cervical spine. We're going to check the trachea, make sure it is midline, and it is. And then we're going to go down to the chest. I'm going to palpate the chest. Patient responds to some pain on the left side, but there is equal rise and fall. Then we're going to palpate the pelvis. All four quadrants are soft, and the pelvis is stable on both sides. Then we're going to go down to the legs, and I notice there is a deformity in the right leg, so I'm going to lay that leg flat. I'm going to check the pedal pulse. There is a strong pedal pulse. I'm going to check the other leg. Strong pedal pulse. For any signs of DCAT BTLS on both legs, nothing other than the deformity here. I'm going to go up to the upper extremities, check for signs of DCAT BTLS, check the radial pulse. Still have a weak radial pulse of 120. And do the same for the other side. Check the radial pulse, any signs of DCAT BTLS. Okay, and then when we transfer to C-spine board, I'm going to check the backside of the patient. I'm going to palpate the spine, check for any signs of DCAT BTLS. Nothing, and transfer the patient. Okay, now due to the patient's deformity on the leg, we've splinted that when we put him on the backboard, and with the initiated high flow oxygen due to the weakened breathing on the left side, and we will reassess vitals every 5 minutes due to the patient's traumatic injury.